can find my screen share. Okie, Sarah, welcome, and thank you very much for doing this Ask the Expert session for Mummy Star this afternoon. It's great to see you again. Great to be able to run a session for you, for both for the families that we support now, the ones that we'll support in the future, but also for many health professionals in different disciplines that follow Mummy Star in our work and find these recordings and these sessions are really good to be able to dip into, to be able to help their the other sort of people in sort of within their care as well. So yeah, a warm welcome to you from myself and the team.
Thank you.
To get started, would you mind giving a bit of background in terms of, I suppose, you and sort of where you've come from, really, in terms of your history?
So I am 38 now. Sometimes I have to remember how old I am. And in 2018, when I was 34, I was diagnosed with cervical cancer. And that was at 19 weeks pregnant. So it was my second pregnancy, and it happened very quickly. We were a little bit shell-shocked that suddenly we were pregnant the first month of trying, and there were kind of issues through the pregnancy in terms of little signs that I was getting. But because my first pregnancy hadn't been particularly easy, and some of the symptoms I was experiencing were similar, I didn't get too concerned about it until probably around about 13 weeks. And I just continued to particularly bleed with no extra symptoms. So it wasn't like I was miscarrying. Something was going on with heavy bleeding, but there was nothing else, like no cramps or anything like that. And it didn't then progress into anything. So I kept going into hospital. I was going through A&E when I was in my early days of pregnancy, and just being told that maybe some women just bleed in pregnancy, and I knew something wasn't right. So I just continued to go in every time I had this spell of really heavy bleeding. And eventually, the 5th time that I went in at, I think it was 18 weeks, someone eventually spotted the 5-centimetre tumour that was on my cervix, and biopsied it straight away there and then, and waited a week to find out after my 20-week scan that it was cancer. And our journey began from there. It was a really scary time, as I'm sure a lot of people watching will know, when you're pregnant and then get a cancer diagnosis as well. It just felt so overwhelming. And we had to wait that whole week, and that week of waiting, I just knew what they were going to tell us. And I just wish they hadn't left us that long to kind of try and find out what was going on. And then we went through another series of tests. So I had MRIs, which you can have during pregnancy, but was looked at quite weirdly, going in there with a bit of a bump, to find out whether it had spread or not, and just to find out the size of the tumour that they were dealing with. And they then staged me and decided a treatment plan. So I was the latest stage 1, stage 1, 3B or C, I think it is now classified as, because of the size of the tumour. So I was offered chemotherapy and radiotherapy in combination to cure the cancer, with the intent of curing the cancer. But I couldn't obviously have the radiotherapy when I was pregnant. And so in cervical cancer, the chemotherapy is pretty much there to make the radiotherapy work better. Taken on its own, I think the best you can expect is for the cancer to kind of just stay at a stable level, but not necessarily improve or shrink in size like it does in other cancers. So we saw lots of different healthcare professionals, and we were given a choice at, I think, 20 weeks, whether or not we should terminate the pregnancy, because at that point it was pre-24 weeks, or continue the pregnancy and try and deliver baby. They were planning around 36 weeks. So that was another 16 weeks away. And my chemotherapy was weekly. So I would have had 16 rounds of chemotherapy by the time baby was delivered, and then would receive more chemotherapy after baby was delivered at 36 weeks. So we worked out something like 26 rounds of chemotherapy, and then the radiotherapy would start after baby was born. So we kind of looked at the pros and the cons, and this chemotherapy had massive impacts on heart and stroke, and there were risks involved, and everything in pregnancy, as you know, is experimental. We went back and forth for weeks and weeks, and time was ticking, was not on our side. And in the end, after consulting a number of different professionals, we decided that we were going to terminate the pregnancy, which happened at 23 weeks and 5 days. And so Jacob, our little boy, was born alive, and he lived for an hour and a half. And it was the most difficult thing that I've ever had to do, because obviously at that stage you do have to give birth, even though you're induced. So it was a very traumatic experience, and one that obviously I will never forget, and was quite probably the worst part of the whole journey. The cancer was kind of the distraction from the grief that we were living with as a family. And I think, you know, we had your support from the beginning. You were one of the first people that we spoke to, Pete, when we just didn't know what we were going to be facing. And to be honest, at that point, I didn't even know that it was possible to have cancer in pregnancy. It seems ridiculous. It's meant to be the most happiest time, you know, of your lives, when you fall pregnant and you're decided to have children and expand your family, and then suddenly the most unexpected, overwhelming news hits you, and then you have to make a decision whether to save yourself as a mother or to save your child. And but also knowing that there's other people at home to look after. I've got a little boy who's 6 now, and he was 2.5 at the time, and every time I looked at him, I just felt so guilty if I wasn't going to be there. And I've never been so torn on trying to make a choice. It wasn't really a choice, it was something that we were faced. We don't know what would have happened if I did carry on with my pregnancy. So there were all of these questions that we went back and forth, and I know that every single family has different challenges and different situations to face, and this is the one that we chose to follow. And it became quite an intense journey of treatment. So I went straight into chemotherapy 4 days after Jacob was born. And then about 4 weeks later, they started my radiotherapy, which was daily on top of the chemo that I was having weekly. And then finished off with internal radiotherapy, so brachytherapy, for 3 consecutive weeks. So eventually I was done about 5 months later after beginning. And then you just kind of feel like, what do I do now? It's been 5 months of being in hospital every single day, like having a full-time job. And now I have to deal with the emotional side of everything that's happened, physically and mentally, and somehow go back to life. And think that's probably the most challenging part, emotionally and mentally, from cancer, is rejoining normal life. And I knew that I just wasn't sure I could do that. So exercise was always a huge part of that, and something that I used during pregnancy, and something that I used in the early days of cancer when I was feeling able to. I'd go outside and I'd move, and it would help with my energy, and it would help with my mental state. And so that's kind of where the journey continued from there.
I think I've shared this with you in the past, and I think we've had conversations over the years. And I know, you know, the rest of the team are aware of this as well. I think because of the heartbreaking scenario that you guys faced as a family, and I remember very vividly that phone call with yourself and your partner when you were, I think, I'll say weighing up those decisions, but I think at that stage that we spoke, I think you guys already knew what was, I think what was going to unfold. I think for you, I think the learning that we've drawn from yourself and the conversations over the years about how we've changed our language, and how making sure that when we talk about a scenario similar to yours, because like you've mentioned, there are other families that we've supported that have gone through similar experiences, whether it's because of the same type of cancer or because it's other types of cancer, but because of the staging that it gets diagnosed at. The language around, I suppose, recognizing loss first and foremost when it happens, that is, as you just said, that's the priority for the family in that moment, not necessarily where the cancer is at or what's going to happen or how that's going to unfold, but it's recognizing that the loss is the priority that you're experiencing, and that's the thing that's first and foremost, and making sure that families are cared for in the same way that any other family who tragically loses a baby at any stage of pregnancy is that is the center point of that conversation and the care that's around them, rather than suddenly rushing somebody into I suppose a cancer treatment pathway and almost losing the care and attention that's needed for that family in that moment, because that's where your heads are at. And I think we've adjusted our language, and I think we've even adjusted publicly, I think, the way we talk and refer to loss in that it's sadly it's part and parcel for so many families in this kind of situation, because of different types of options, treatments, and personal, above anything else, as you said, personal decision making. In your case, where you already had a child to consider within your family unit as well. I just wanted to cover that, because before we go on to sort of more about sort of where you're at now and what's led to that, because I think it's important to recognise, because I think sometimes within the conversations about cancer and pregnancy, I think this gets lost because so much of the focus is on the pregnancy, or people, I suppose, trying to get through treatment because of, what's going to hopefully happen. But we know, that there are many, many families in just a situation as yours, and it doesn't get talked about often enough. And it's part of I think it's part of breaking taboos, and it's what we've got to do. We've got to talk about the things that people are least comfortable talking about. And I think that's one thing that of many things that you've done over the years, I think it's something that you've really opened the conversation up about. And I know when we talk to students now, when we deliver a lot of education awareness sessions, when we go through case studies, yours is one that, as you're aware, that I talk about regularly to students, because it does open their eyes up to, what if that situation occurred? How would you respond? How would you make sure that you care about that family in the way that they need, rather than what you're comfortable with as a person? And it's so important. And it's just, thanks for always, having been willing to, to allow us to do that, I suppose, with your story, because it's a real privilege for us to be, I suppose, with you or alongside you in any shape that we can be, when, at such a vulnerable time, that, and it continues, like you've just said, it doesn't stop at where it happened. It's how it carries forward. But I guess that brings us into, I suppose, then this recovery that you sort of have gone through step by step. But before we do that, before all of this unfolded for you, what was your background before you got diagnosed with cancer? What was it you were involved in, or what in terms of I suppose the wider context, or where you've come from?
So I always loved science. I loved medicine, but I didn't actually get into med school, or I don't think I tried hard enough at school. But I loved science, so I did a biology degree for 4 years at Leeds Uni, and then came out of that and went into kind of medical communications, so communicating medical data to general public, but also to doctors, nurses, so working on behalf of mainly pharmaceutical companies to talk about different medicines, but also talking about raising awareness of different types of diseases, and cancer being one of those. I worked in prostate cancer for quite a long time, kidney cancer, so I do have a background in medical language, medical understanding, from my previous career, which I worked in for probably around 12, 13 years. So I worked in an agency in London, and I was commuting there every day up until the day that I went to hospital and they found the tumour on my cervix. And then just also going back to your point, Pete, in terms of how this is spoken about, I think it's quite a rare occurrence, and it's one that I found had very little support about. And I think this is why it's so massively appreciated, the way that you have changed the way that you communicate about families that have to go through a termination for medical reasons, and that can be different from a termination because there's something not right with baby, and when there's something not right with mum. And that's what I found the most difficult thing, was dealing with the guilt that I chose my life over my child's, but for the benefit of other people around me. You know, it wasn't completely that kind of black and white decision, but that's what I always struggle with, and what I dealt with a very long time, I still deal with a counsellor, and helping with that kind of psychological element. From the beginning, I had support, and I think that probably has helped me to this day to maintain, you know, continue doing what I'm doing now, but also to see that I can continue even with that guilt that kind of sits alongside me a lot of the time. But trying to raise awareness of families that do have to make that decision when mum isn't well, and she, you know, wouldn't be able to look after child perhaps if something terrible happened. And it was that choice, I call it a choice, it really wasn't a choice, it was that choice that was so hard. And the team that I had of midwives who were at the Royal Surrey were absolutely incredible, but the setting was wrong. I was in the labour ward, and they had to put me in there because I was high risk, and they were worried that something was going to happen during labour and I would need to go into surgery. But I was in the centre of labour ward, and that was really, really difficult, because especially the next day when you then go to leave and all you can hear is screaming babies around you. So it's such a rare situation to be in, but at the same time there's just not the kind of infrastructure within hospitals to support people that are going through such trauma and need that kind of emotional support away from seeing babies everywhere. There was just nothing, and that's what I found with exercise as well. There was nothing to support people like me. There were people to support exercise after pregnancy, during pregnancy, which is kind of the type of exercise rehab that I needed after all of the treatment that I'd had to my pelvic area. But I didn't want to be with babies, and so that's kind of what then grew into my business. So developing a niche or finding some area that needed support, and because exercise was such a big part of my recovery and such a big part of my mental rehabilitation, I knew that's something that I wanted to do. And I did join the postnatal group, and there were babies that turned up occasionally, and I did have to face my fears. I mean, I live in a town that is full of yummy mummies and, you know, gorgeous babies and pregnant people, and that's really hard. But actually you have to face that daily. You can't get away from that. You see it all the time. And to begin with, it's really hard. Sometimes it's really hard when I see a family of 4 with 2 boys. I find that impossible, but I just have to, you can't avoid that type of situation. So
I think it's one of the cruel things, isn't it, that I think anybody I know that's ever has experienced any kind of loss for any reason, there is always that, I think, cruel slant that as soon as it's happened, you walk out the door and the first thing you are greeted with is a poster of a baby or a picture of baby products, and it's so in your face. Whereas you can walk around, you know, most of the week and not see it, but there's those key moments. It's almost like an added layer of cruelty when you're trying to, you know, bring that recovery, you know, into yourself. It's you couldn't make it up.
I know. It's like, you know, the questions that you get asked on all the scans, you know, are you pregnant? Well, no, just had a whole load of treatment that's taken away that opportunity. And I know you can't take that away. I asked that as part of my screening questionnaire because I need to know. But it's when you've been through such trauma, everything comes from that. You know, everything you think about is about that. So that's why you say, you know, when you spot somebody, you always hunt out the people that you don't want to see almost, and the things that you don't want to see, but that are there in front of your face and have been for the last 10 years, but it wasn't so obvious to you, I think.
Yeah. Going from that then, in terms of how you're, I guess, trying to take steps sort of from your cancer treatment and your recovery and everything else that you guys are contend with in terms of the emotional trauma of that, how did you then formulate, might be a bit of a clunky word to use really, but how did you then I suppose, pull this together and start to structure it in a way that was going to, I suppose, help you as part of your own recovery, you know, both physically, but also, I suppose, the you know, I suppose, perhaps plowing your grief into it, the trauma that you've experienced, and actually putting this in, all that energy into what now is Get Me Back, and everything that you're doing in terms of, you know, for supporting the wider cancer community.
So I, as I said, started exercising when I felt well enough. So I finished my treatment at the end of August, and I did some really gentle walking, yoga, just really starting to move gently to begin with. It probably wasn't until the end of October, so about this time, where I started to feel ready to join a group exercise class and kind of build up a little bit more strength where I'd lost a lot of muscle mass. So I joined a group of ladies. It was an outside class. It was a postnatal woman, but I trusted her, and I knew that there would be occasional babies coming to the class, but I felt like this was the right environment for what I needed from a rehab point of view. I had just had a baby after all. And so I went to this class. I really enjoyed it. I made brilliant friends, one of whom was actually very heavily pregnant at the time, but she was just amazing and very understanding. And it got to about January time, and I thought, actually, do you know what? I need to create something for people like me. You know, there are things that exist for young people kind of in their 20s. There are kind of classic seated exercise classes, but there's nothing for that age group in between, you know, 30 to 60, or with a few years in between. There's nothing for us where you can be pushed. I used to be really fit. I loved going to the gym. I loved going to exercise classes. What can I do? What can't I do? What should I be careful of? Like, no one knows.
Can I add something in, Sarah,
sorry.
as well? I suppose the important thing within all this and our catchment is we are young.
Yeah.
Exactly. As we
Exactly.
are in, you know, 20s, 30s, 40s, we are a young catchment, you know, despite cancer. And I think that is probably what's at the root of a lot of this as well.
Yeah. And why isn't there enough support for these people that are the ones who are desperate for exercise, and they're the ones that are proactively hunting it down? So I looked into qualifying as a cancer and exercise specialist, and with my science background, it was really helpful to get me through it quite quickly. So in the time that I had off, which was maternity leave, I was given maternity leave as a result of Jacob being born alive. I decided to put my last 3 to 6 months, I think, to use, and I studied constantly for about 3 months and qualified as a PT, just a general PT, with the intention of going into the cancer world and thinking I could do this alongside my 3 days a week of my job that I still had back in London. And then, as fate would have it, I got made redundant about 2 weeks before I was due to go back to work, which is another story. And then decided that I was just going to throw myself into this and that it was meant to be. And so I set up my company, GetMeBack, because that's exactly what exercise did for me. And I'm not saying it got me back to my pre-cancer self, it just got me back. So my control of my body, my life, my brain power, my strength, it got everything that made me and the new me. So I launched the business, and physically I was still regaining my own strength. So it has taken, I mean, it'll be 4 years in May, and I now work 5 days a week, and I can do that now. But in my first, I think, 2 years, my energy levels really struggled if I pushed myself too far on the occasional day. So I had to build up to it. So I started on taking on clients, and these were non-cancer clients predominantly, but who wouldn't want to use exercise for health reasons. They weren't looking for the primary reason of it being aesthetic, you know, how thin they were in a bikini. I wasn't interested in that side of things. I wanted to make people strong because they wanted strong joints. I wanted to make people feel, you know, energized because they wanted a healthy heart. It was all for health reasons. So I continued doing that and then continued studying, and I went through 2 more levels of qualification to become a cancer and exercise specialist, which I did within the year, and then really started pushing to support people who have cancer. But still my client base was quite general. And I was a little bit scared to make that jump into that specialist community and just do cancer. And then lockdown happened. And that's kind of what was the turning point for GetMeBack, when people realized that actually they could exercise from their own homes. It was safer from a kind of infection control point of view. It was easier for them to have equipment at home, and they could reach me because I am one of very few. There are more and more of us, but there aren't cancer and exercise specialists in every single town. There are more coming through, but they aren't everywhere. So people could exercise through Zoom. I have clients in Hong Kong, Spain, around the world. So I work with them from their living rooms and from my bedroom, and we exercise every day. And it just became this very specialist business. And actually, the more I specialized, the more people wanted the support from me, because obviously I was working with that community day in, day out, and I see it all of the time. And then I saw this amazing course come up just for breast cancer. And so I took that because most of my clients are now breast cancer. So I'd say now I work with 80% breast cancer and the rest is different types of cancer. And I work with women and men, women mainly through a rehab program to support the recovery from breast cancer, from surgery, chemo and radio, but also started working with gynae cancers like my own, and ovarian cancer, endometrial cancer. And then I have a few people who have cancers not on that list too. So that's kind of where the business really started to grow, was when lockdown hit and everything went online.
So I guess in terms of the exercise then, I suppose, because I suppose a lot of us dipped in and out of that, the how popular it became during COVID, and it was that accessibility, and then all of a sudden, a lot of us now, self-included, now don't do as much of it now as you did do during COVID. But I suppose a lot of people would hear the word exercise and then frame it within cancer and think, oh yeah, but, oh, you know, and I suppose place restriction. Now, can we talk a little bit more about, I suppose, what the exercise actually is, and its format and the types of exercise that you do? I suppose, because a lot of people could be looking at this and thinking, well, because of a procedure you've had or because of surgery, and I suppose it's the mix of mobility versus gentle joint strength, as opposed to traditionally what people might presume when they hear that, which is weight gain and like you said, muscle mass and the aesthetic side of it.
I mean, I think it's a combination of the two, really. So cardiovascular, so things like walking, cycling, swimming, things like that you can do generally on your own terms. You want to be doing around 20 to 30 minutes a day. And I always recommend that people go outside, because you get your vitamin D, but you also get your kind of mental health element of being outside, even in the rain, which is on its way again. And then what I tend to help people with is more the strength and resistance training. And that doesn't necessarily mean lifting really heavy kettlebells or dumbbells. You can use your body weight, you can use very simple things around the house. But the benefits are for your joints, for your bones, which can become weaker, particularly those who've been put into medical menopause. But also to regain some of that muscle mass that you might have lost through chemotherapy, and particularly the use of steroids, which come alongside that, where it can cause muscle wastage. So rebuilding that is really important. And that is just, it's quite simple programs. I mean, I am training people who do lift barbells and do lift kettlebells because they've got that strong, and it makes them feel really, really good. And it's great for things like menopause and metabolism. But obviously making sure that you're focusing on the right type of muscles and you're progressing at a steady rate is something that I always advise for anyone who's had any lymph nodes taken as a result of their treatment. So the one thing that you're advised, particularly when you have your lymph nodes taken, is to not lift too much too soon. Some people take this a little bit too far and tell you not to lift up the kettle. I think, you know, we can start moving forward from that now. But weight training is hugely beneficial to anyone who has been through a cancer diagnosis, pretty much, even for those that are stage 4, with clear guidance and knowing exactly where their mets are. They can also strength train, and it has been shown to help improve their bone density. So the more studies that are coming out, and these are coming out, on a monthly basis now, there's so much evidence that exercise, including strength and resistance training, not just cardiovascular training, is beneficial across the board for cancer and recovery, and even actually reducing your risk of recurrence. There is one study that shows that it can do that by up to 30% in some cancers. So by exercising, following the guidelines of your minutes per week of cardio and a couple of strength training sessions a week, has been shown to reduce your risk of recurrence of cancer. So it's something that's really important and that people need more guidance to do, particularly after cancer treatment.
What do you think? Because I know when we started 10 years ago, exercise wasn't within the framework of cancer conversations. You just didn't hear about it. And I remember, I've known people who have been, close friends who've been treated for terminal cancer, and they've been able to run ridiculous distances because they found they offset some of the cancer treatment. But equally, I've known people who are getting treated for primary disease who struggle to even leave the house. And I suppose there's a fine line, isn't there? I suppose that people don't see somebody who can achieve an exceeding amount of exercise as a benchmark to go, well, if that person can do it, therefore I can. But I think this is from what I've seen and what I know about you, I think that's what the beauty of this is. It's so well balanced in how it's how it's put to people, that it's not about you can get from here and 6 months time you'll be up here lifting this or being able to do all these. It's not an intensity type exercise. It's more the focus on the movement and I think as you phrased it, I think getting control back of, I suppose, some of who you are and your identity and how you feel comfortable, as opposed to setting. I suppose we can get into the mire of setting targets that then can have the reverse impact psychologically on people, don't we? Think, well, I haven't been able to achieve that, therefore I must be failing. I mustn't be recovering as well as I wanted to. And I guess it's not reducing your targets. It's setting them at, I suppose, more of a bite size.
Yeah, and I think I'm all for setting targets if someone wants to achieve something. I took a lady through an 8-week program back in January, and she's just finished an Ironman. So, she, a year on, she has achieved an amazing thing. And that was her goal. That was always her goal. And she trained really, really hard. And I know she went through a lot of pain and kind of, lots of different hurdles. And I think that's the whole point, is that it's not linear. Progress isn't linear. Particularly post-cancer, there are lots of dips in that line on the way up, and that doesn't necessarily mean that if you hit that low that you're as low as you were at the beginning. And I think that's why it's really important that people keep almost like a diary of how they felt physically, because if I look back, and I remember doing this in the early days, if I look back, I think actually last week I only had to go for a nap twice. This week I've only had to go for a nap once, and I've managed to go out on my walk the day after I did a workout. And then the next week I could have done another workout the next day, or I could, pick my child up or do something more, because those things, they're different steps. They're things that you appreciate more. And I think the most difficult thing and the best advice somebody gave me was, stop comparing yourself to your pre-cancer self, because it doesn't mean you can't achieve what you did before your pre-cancer self, but do it for different reasons, and realize that your body has been through so much and you need to treat it with respect. So you need to make sure the strength is built correctly, with the right form in the right places, and that you're fueling your body properly to be able to do all of this stuff. You're getting enough sleep, you're drinking enough water, and you really are genuinely looking after it. Because perhaps pre-cancer, we could have got away with, the occasional bad night's sleep, or, not drinking enough water one day. But post-cancer, you have to really kind of keep that consistency up, and you do see results and you can see progress. I'd say during treatment, probably not so much. You want to the aim is just to maintain. But once you finish your treatment and your body's starting to recover, you can see progress, definitely, but it just might not be quite as quick as you once saw it before, but you will get there. I think that's the important thing.
I think that's I suppose the language in recovery or in living with, and with or beyond the impacts of cancer, I think is, I think it's being used less now. We used to hear this phrase, you'll get used to a new type of norm. And I don't know about you personally, I also used to find that phrase quite restrictive on the person, because you think, well, your level is your level, not what you're told you should expect to be. And I think the way you just phrased it is a far better way of talking about that, in terms of, setting your own, goals for yourself, rather than that comparison. Because I think we are, even within the as widely serviced the cancer sector as we have, I think there has been elements of competition and comparison that have crept into it over the years, even in our 10 years. And I think it's really important that people don't try and avoid that benchmarking against what they see out there on Instagram, or the people that achieve what seemingly superhuman feats. Doesn't mean that what you achieve isn't to you, and where you were at 6 months ago superhuman from where you were at. And it's all relative in terms of your own personal goals and experience. But I guess for the person that's being trained or is being supported by you, knowing what you've been through must make that a far more fluid journey for them, to think, you know what, you understand this, you get why this can be so difficult, you understand why it has to be so staggered at times, but that you can set these targets for yourself that are achievable.
Yeah, I think it definitely helps. I mean, I can relate in some ways to what people are going through, and I can see similar journeys of some of the clients that are going through, but ultimately everybody is completely different. And that's why it's so important that the kind of offering that I provide is so personalized, and what might be right for somebody is not necessarily right for somebody else. And so you have to listen to your body, and you are your own voice. So if something's not working, it has to be communicated. So we also try and make sure we have good relationships, because if something hurts, or something doesn't feel right, or something makes you feel a certain way, then you're the only one that's going to know about it. So making sure that we have that communication, and they tell me about that, they give me that feedback, it's really helpful. But I think, yeah, from a relatable point of view, I always remember doing exercise at the beginning and knowing I'd gone too far if I hit a wall, which seemed to have come very, very quickly into my face. And that's when I knew I'd overdone it. And that was quite a useful understanding of how people might be feeling, particularly during their treatment, is that actually that wall comes up pretty quick. And to give them that pre-warning, if they're starting to feel a little bit lethargic or they're not feeling great, then we close it down, we start to slow down, so that they don't hit that wall. Because when you're exercising, particularly during treatment, you want to exercise for energy and to tolerate the kind of treatment better, not to be completely exhausted. That's not the goal. So people being pushed by PTs like to complete exhaustion, that's not helpful in cancer rehab. You want to use this as a tool in your kind of side effect toolbox to help people feel more energized, to have less side effects, to be able to tolerate their treatment, go back week after week and get their treatment that's helping them, and just not feel so bad, to live a better quality of life as a result of it. So yeah, being able to understand what people have been through is definitely helpful from a kind of treatment point of view, and understanding the menopause as well is another thing that I think is quite helpful, having been through it myself. So being able to relate to people's hot flushes and joint pain and things like that is knowing how to adapt exercises if somebody's struggling in one way or another, so that they can still move and they feel able to move their bodies, that they're kind of being looked after from a side effect point of view.
Yeah. Before we bring it to a close, just in terms of where and how people can access more and find out more about you and the classes that you run as well, just to pass over to any of the team that are with us, really, if you've got any other questions for Sarah before we bring things to a close. So we've got Fiona, Sarah, Tracy and Amy with us as well, all our whole support team.
Sarah, if I can just ask, so for many people, they have exercise prior to diagnosis, but for those people who've never done any form of exercise, and they do start to think, I need to do something, like you say, all the studies that are showing that certainly with the breast cancer, how that can help. Where would somebody start? I know that's a really tricky question, but I think you know, there are mums in that situation that are not sure where to get the information as to the best kind of support like you offer. But as you said, it's not available. You know, there aren't cancer, support, exercise support in all areas. So where is the best place to start, I guess?
So I'd start making sure just walking is part of the daily routine. So making sure there's a 20 to 30 minute walk every day. And just trying to stay on your feet, being as active as possible. In terms of starting to introduce some strength and resistance training, Macmillan have a Move More program, which gives some advice on simple movements. I would imagine someone like a postnatal, if they've been through a pregnancy and they're happy to do so, a postnatal fitness class is quite a good way of starting. But making sure that just in touch with somebody who is aware of maybe if they've had breast cancer, what they can and can't do with their upper body. But from a kind of pelvic floor and pelvic health point of view, the postnatal professionals and PTs are very good at understanding how to manage post-birth kind of pelvic movement. So that would probably be a good place to start, but just getting in touch and knowing what the limitations are. And that's something that I try and talk about quite a lot through my Instagram feed. So things to avoid in strength training, particularly post cancer treatment, breast cancer treatment. And then just going to a class that they feel comfortable being part of, armed with that information. There's also an organisation called the Can Rehab Trust, and they have a database of cancer and exercise specialists like myself all around the UK who are either PTs, kind of then gone on to a specialism, or they now train physiotherapists as well. So physios are a good place to ask information to as well. They tend to be in most hospitals. So you'll be able to get a bit of a starting programme, I'd say, from a physio as well.
Was that Can Rehab Trust, Sarah?
Yeah, so CAN and then Rehab Trust.
Yeah, thank you. That's really good information, like you say, just as a starting point. Because even if you're just starting walking, you feel that you're doing something.
Exactly.
But also around the, the postnatal, because of the, like they say, their experience, whoever will be running that class, then they will be able to, help support.
Yeah. No problem.
Okay. Anybody else got anything you want to ask? Well, we've still got Sarah with us. Well, most importantly then, Sarah, how can people find you? How can they access the classes that you do? I think I've alluded to it, I think, earlier on, but the sessions that you do with Future Dreams online as well. How can people find more info? And we'll obviously put this with the recording as well, so that people can access it that way.
No problem. So I run one-to-one sessions and also group classes through my own company, GetMeBack. So the web address is www.getmeback.uk. And as I mentioned, I work in breast cancer a lot. So I've designed an 8-week recovery program, which is all online. And it's a series of workouts and stretch classes and lifestyle information to support people to get back to fitness after a breast cancer diagnosis. And I've had people go through the course who are still on treatment and those who've been out of treatment for 3 years, but it's designed to kind of introduce strength training, give you an overview of how to use cardio, but also to regain some of the strength and mobility through your upper limbs and your core. And then I also run, for people that have finished that course and want to carry on, I've got a membership, so people come and they do 2 classes a week with me, and that's a kind of ongoing rolling thing, but they're obviously feeling kind of safer in an environment where they are supported by a cancer and exercise specialist. So that keeps people moving. That's the same, a couple of strength classes a week and a stretch class and a big Facebook community behind it. And then I work for the charity Future Dreams, which is a breast cancer charity. And every Wednesday at 12:30 online, I run a Get Strong After Breast Cancer class, which is kind of a little bit more of an introduction to strength training. I tend to get people on there that are just getting started. and you can use things like bean tins and water bottles and broomsticks, and tends to be things that you can find around the house. So yes, and I work in Reigate in Surrey, if anyone is local, but as I said to Pete, most of my business now is online, so I can work from wherever we are.
And what was the 5K program you mentioned? I think
yes.
before we started recording.
Yeah, so there's a charity called Move Against Cancer, and they started an initiative called 5K Your Way, which tags on to park run once a month. So that's on the last Saturday of every month. And there are a number of different towns across the UK that are involved and have ambassadors. You can find them on your website. But they basically meet at 9 o'clock on a Saturday morning, and you can walk, jog, run, cheer, anything that you want to do, the 5K or half of the 5K route to get moving against cancer. And I work as an ambassador for the charity on the last Saturday of every month. So if you find your local park run, you can find out whether they've got a group there, and they meet, do the run or do the walk, and then have coffee afterwards. So it's a nice little initiative to get you moving and get you meeting local people. So yes, and any information that I've mentioned today, particularly to Tracy, around things to avoid to doing post breast cancer treatment and cancer treatment, is on my Instagram, which is at GetMeBack UK, and that's the same on Facebook and YouTube.
Super. Thank you. That's been a really great introduction to. I know there's a lot more that you can cover and delve into, I think, in terms of the specific, but I think it sets. I think what's so important about this is it sets. There is a really important context in terms of where you've come from to what what you're doing now, and what obviously is always ongoing for you. But I think a lot of people will relate to much of what you have talked about today. I think, but it also just it's the accessibility of it, I think, is the main thing for this. It's not like, saying to someone, you've got to do some really intensive, massive program for the next 10 weeks. It's that bit where people can almost pick and mix, in terms of what they want to do, or to what that's going to best, sort of fit them. And like you said, their treatment, where they're up to in terms of recovery, and, sort of for them to be able to, sort of set their own targets. So just a big thank you. For giving the time to to come and talk and share what you've been through, and again going sharing back over what you guys as a family have been through over these last 5 years as well. It's like I said at the beginning, it's always been a real privilege to have been sort of had the opportunity to be in touch with you over the years, and just really glad that you've been able to get you on to do this. So thank you very much.
Thank you,
great to hear from you.
Thank you very much. And I really appreciate what Mum and Sarah has done for us as a family as well, and the kind of changes that you made so quickly around wording and the language that you use for families like ours. I think hopefully that supported a lot of other people who unfortunately have been faced with similar decisions.
Yeah, I think it has, and I think that's reflective, I think, in some of the families that we've supported since, and I think that they sadly will come to us now without hesitation if that is the simple situation they're in. Whereas I think previously there was is this for us? Is it not? I'm not sure whether we'll fit in. And I think over the last few years, I think we found ourselves having more of those conversations, but in a roundabout way, it's a positive step that they have seen us as being for them, as well as the other families that we support in pregnancy or postnatally as well. So it's been a learning curve that I wish we hadn't had to learn from, but it's one that I think we try and do with every family, is to carry it forward for the next sort of person that's going to get in touch. So thank you.
No problem. Thank you very much for having me.
Thank you.